Hi, I am Dr. Puja. I'm a board-certified family medicine physician, and today I'm going to answer a lot of questions about CeraVe and ceramides. The table of contents is behind me. Scroll around, and let's get to this. So, number one, what are ceramides? Basically, ceramides are lipids which live within our stratum corneum. The stratum corneum is the most exterior layer of our skin. And the main purpose of ceramides is to help protect our skin. It basically helps strengthen our skin's protective barrier against infections, inflammation, irritation, and all other things that really could make us susceptible for a lot of inflammation. So ceramides are found in a lot of products that are hydrating. So that's creams, ointments, lotions, and moisturizers. So the common and logical question then is, well, if ceramides are found in those hydrating types of products, will ceramides cause acne? Will they clog your pores? So the answer to that is no. Ceramides themselves are not going to clog your pores. It's other comedogenic ingredients such as like palm oil or heavy occlusives, mineral oils that will and can cause acne and can cause a clogging of your pore, not necessarily the ceramide itself. So the really exciting thing about ceramides is that it actually will help your acne. So because it is repairing and optimizing your skin's natural protective barrier, you're actually going to improve your acne. You're going to improve the redness, the irritation that may be on your skin. So that is, ceramides are really good for people that have acne and people that have other types of skin conditions. So the next question is hyaluronic acid a ceramide? The answer to that is no. Hyaluronic acid is not a ceramide. Hyaluronic acid is actually a hydrophilic molecule. So what does that mean? What does that do? Basically what that means is because it's hydrophilic, it loves water. So it's the hyaluronic acid that's actually helping with the moisture content within your cell. The ceramide is a lipid. It doesn't really like water, but what it does is it causes your skin's protective barrier to be really strong, so then it prevents any type of evaporation of the fluid, of the moisture that the hyaluronic acid is holding on to. So ceramides prevent the evaporation of fluid from the cell to the environment. So, both of them together are really gonna improve one's skin quality, but hyaluronic acids are not ceramides. All right, this next question is, do ceramides help wrinkles? So ceramides help reduce the appearance of wrinkles, but they don't really get rid of the wrinkles. Ceramides work by plumping up the stratum corneum, which is like the most exterior part of our skin. So ceramides help plump that up. So that plumping effect is what will diminish the wrinkles. Usually to remove a wrinkle, you have to have a product that's actually causing regeneration of your collagen, or that product is preventing degradation of your collagen. Usually retinoids is what comes to mind. Retinoids is something that will help reduce your wrinkles, it'll help repair your wrinkles, and it actually helps prevent wrinkles. But when it comes to ceramides aren't really going to get rid of the wrinkles, but they will help diminish the appearance of them. Okay, on to the next question. Are ceramides natural? Yes, ceramides are very natural. They're actually all around us, and they are molecules that we actually make in our own body. For example, ceramides are found, in addition to our skin, they're also found in our brain. Ceramides are also found in our joint spaces. Ceramides are found within our nerves. They're a huge part of signal mediation within our central nervous system. So because ceramides are natural, they're also found in a lot of foods. For example, spinach, eggs, soybeans, all of those have a lot of ceramides in them. A common question then a lot of my patients will ask is, hey, well, if foods have ceramides, can I just eat a lot of ceramides through my food? So the question is yes, For any type of vitamin, any type of micronutrient, it doesn't matter what kind of micronutrient or vitamin it is, the best way to actually incorporate it into your body is by consuming it in its whole form. So, eating eggs and eating spinach. So because ceramides are lipids, which are basically fats, a lot of the over-the-counter supplements of ceramides actually are basically just fat molecules. So those supplements will affect your total cholesterol. I mean, why is that important? What does that mean? Well, that means that you're then going to be you're going to have a higher risk of developing heart disease, strokes, heart attacks. So the best way to really optimize your use of ceramides is by eating a whole food diet and also by using products that have ceramides in them. On we go. So what's better, Cetaphil or CeraVe? Well, each person's skin needs different things, so I'm really not going to comment on which is a better product, but because this video is about CeraVe and this video is actually about ceramides, CeraVe is going to be better with that respect. So each of CeraVe's products has ceramides in it. Cetaphil only has a few products in its line that has ceramides. So with respect to ceramides, CeraVe is probably the better product. All right, on to the next question. The next question is, what moisturizers have ceramides in them? So there are a lot of moisturizers now that have ceramides in them because ceramides is something that a lot of makeup companies, a lot of cosmeceuticals are really taking advantage of because it's such a good ingredient. The one that I absolutely love is CeraVe. The second one that I love is Elta MD. Both of those are amazing skin lines. They've been around for years and years and years. And CeraVe was actually one of the first product lines that came out with ceramides. Elta MD is a moisturizing line that you can purchase at your dermatologist's office or from their website in itself. There are a lot of knockoffs of Elta MD, so be careful that you just don't purchase it randomly. Make sure that you're able to confirm with their website that it's actually a real product. Elta MD is about $38 or so for a bottle of their moisturizer. It's an SPF of 46 and it's a mineral-based SPF. And the CeraVe one, the one that I use is the AM CeraVe lotion. That's like about $12 or so. So people that have a lot of pigment naturally in their skin, sometimes when they use sunblocks that are physical-based sunblocks, will or can get like a white tint after wearing those products. So CeraVe and Elta MD, what they did a while ago is that their zinc oxide, so the physical molecule that's preventing the sun rays from going into your skin, those two brands have created very tiny particulates of the zinc oxide. So it's a much more finer product and it's just a little bit more elegant when you put it on. One tip that I have for the CeraVe moisturizer is that when you apply it, you can kind of mix it a little bit in your hand, and then that is going to help diminish the white tint that you may develop after applying it. All right, on to the next question. Okay, next question. Why do dermatologists always recommend CeraVe? So yes, all of my dermatology colleagues definitely recommend CeraVe. I also recommend CeraVe. I'm a family medicine physician. And the reason is because there's a lot of data that supports the efficacy of this product. So CeraVe first came out in about like 2005 or so. So that's a long time. That's what, 15 years or so. The reason why that's important is because it's then telling us that, yup, this product has been performing the same way year after year after year, and there are no egregious side effects that people have really developed from it. The other reason why a lot of my dermatologist colleagues prescribe it is because it protects your skin's natural barrier. I mean, this really helps us to kind of summarize this entire video in the sense that ceramides are so important when it comes to our skin's overall health, and CeraVe's, like all of their products, have ceramides in it. So I think that that's another reason why this company is recommended a lot by dermatologists. So the next question is, does CeraVe help eczema? So without a doubt, the answer is yes. CeraVe is going to help eczema. The way that it works is it's basically helping to rebuild your natural skin's barrier. People that have eczema will have little holes, if you will, in their stratum corneum, and their skin is like always in contact with any types of irritants. So that in itself is going to cause a lot of irritation. So without a doubt, if you do have eczema, talk to your doctor. CeraVe is going to be a good option for you. The other question that I get is, well, hey, will CeraVe, will ceramides help my acne scars? So the answer here is no, they're really not going to remove your acne scars, but they're going to improve the appearance of acne scars. When you look at an acne scar, there are many classes of acne scars. A person that has active acne will have a short period of time that sometimes can last 3 to 6 months. So that period of time, that person's acne spot has resolved, but they're gonna have a dark spot. That dark spot might look red or it might look hyperpigmented. And a lot of times people assume that, hey, that's actually a scar, but it's really not a scar. So ceramides will help kind of plump up that skin. The sunscreen that's within your lotion is also gonna help prevent that hyperpigmentation. So a lot of times when people are like, hey, my acne scars have really gotten better, they're getting better or they're appearing to look better because the hyperpigmentation and the post-inflammatory erythema, like that redness that people can get after they've had an acne spot, really is going to get better. All right, gang, that was it. This was a lot of fun. There are going to be lots more videos coming your way where I answer a lot more questions. So like, subscribe, and as always, information that you find on YouTube, in addition to my videos, should not be construed as medical advice. It's always very important to speak to your own medical health team and professional about any questions that you might have. Bye. This has been Dr. Puja. Bye.